today and the terrible traffic. I'm so sorry. I think it's my great honor to be here to talk about infectious disease control in China and in Jiangsu with you. I majored in TB control, TB, tuberculosis. Yes, and today I will introduce coronavirus disease 19 and TB control in Jiangsu in China. I think perhaps you are very interested in the coronavirus disease 19 control in China. So let's begin. I'd like to introduce something of Jiangsu province. And Jiangsu province is located along the eastern China in the prosperous and beautiful Yangtze Delta. And I think three figures can describe the situation of Jiangsu. 1% of area, 5% of population, and 10% of GDP in China. This is some pictures of some famous rivers in Jiangsu province. I think perhaps you will have India's or I will introduce some background of Jiangsu province. We can see from this slide that the average life expectancy of Jiangsu is higher than that of China and lower than that of developed country. And the maternal mortality rate of Jiangsu province is much lower than that of the average level of China, much lower, and a little higher than that of developed country. And for the infant mortality rate, we also can see that the rate of Jiangsu province is much lower than that of our in Jiangsu. We have three levels: province, city, and the county. And the relationship between the bureau is administration, and the relationship between CDC is supervision and instruction. This is my explanation. Jiangsu CDC was set up in 2000. It's based on former provincial sanitation and anti-epidemic station. And it's a full financial allocation institute. And we have 2 country yards, 5 buildings with almost 40,000 square meters working area. Have you ever been to our CDC? No. Oh, okay. I think next time you can ask your teachers to give you a chance to visit our CDC. Yeah. And for its large population, there are 130 CDC in our province. They have formed a large working network. And this slide shows some pictures of some region CDCs such as Xuzhou CDC, Suzhou CDC, Changzhou, Nantong, Yangzhou, Taizhou, and so on. So how do you about coronavirus disease 19? I think it's something that you're most interested in. And first, we talk about the source of infection. Of course, first, people think the source of infection is wild animals, yes. And later, we know that many patients, asymptomatic infected persons are source of infection. And recently, we find that the contaminated cold chain items is also a source of infection. And the route of transmission, of course, droplet transmission, such as cough, sneeze, talk, and sing. And I think you are very familiar with this. And also contact transmission include contact mouth, eyes, and nose after touching contaminated items. Besides this, the aerosol transmission, fecal oral transmission, and blood transmission, and so on. There are a lot of routes of transmission. And all people are susceptible, And we also found that the elderly and the people with underlying disease are at high risk. Next, I will introduce the clinical features of coronavirus disease 19. The severity coronavirus disease 19 includes asymptomatic infection, mild and common pneumonia, and severe and critical type. And about 5 to 20% of the patients are asymptomatic cases. The latent period is 1 to 14 days, 1 to 13 days. And about 97% of the infected patients developed symptoms within 11.5 days. 11.5 days. Yeah. The main symptoms include fever, dry cough, and fatigue, and also sore throat, stuffy nose, runny nose, diarrhea, and also the symptoms of some patients. And for the severe cases, they will develop difficulty in breathing and chest pain, and later perhaps die. Yeah. And this is the composition of disease types in different age. We can see the fatality rate varies significantly among different population, and the fatality rate increased with age 5 to 7 years, about 0.3 per thousand, and when over 85 years, the rate increased to 305 per thousand. And as of November 22, and the data is as of November 22, a total of about 58 million and 319,700 confirmed cases have been reported outside China, with a total of 1,381,583 deaths. Yes, it's very terrible. It's very terrible. Control the source of infection. What did we do? What did we do? We do early detection and early isolation, and treatment of infected persons. Yes, this is what we do. And second, cut off the channels of the transmission. Avoid exposure to infection. Personnel protection, such as wear mask, and environmental disinfection. And this is a strategy of cut off the channel of transmission. And the second, with protection of the susceptible. Yeah, isolation is one of the strategies. Next, I will introduce how we will strengthen the management and the control of population in key places and institutions. First, such as in public places, closed vehicles, and enterprise, we practice social distancing, 1 meter, social distancing, and improve air circulation. Yes, and disinfection and monitor body temperature. For example, when I enter in the campus I must accept the temperature monitor. Then I am okay. Then I can enter the campus and avoid crowds. Yeah. Now, because the nearly no patients in China, so we can sit together, and in the January, February, and March at that time, avoid crowd is very important. And in school and kindergarten, we do health monitoring and reporting. Check morning and noon check and tracking down and registering the cause of absence due to illness. And also high-risk countries import cold chain food is now we still do this, do a lot about this. All the import cold chain food need to be tested. Yeah. So, and recently a lot of imported cold chain food is tested. Is tested. How does it? Positive. Yeah. And in elderly care institution, welfare institution, division sites, we access management, health monitoring. And in customer health quarantine, we do strict control of important infection, key population medical screening, and high-risk countries import cold chain food. And also, I think this is very important. It's very important. Prevent hospital-acquired infection is very important, and the government put a lot of emphasis on this work. All staff in medical institutions should implement standard prevention according to their host needs. Yeah. Cleaning and disinfection of medical devices and contaminated articles, ground and air, etc. And for the medical staff in direct contact with the virus, the most strict protection measures. And for the people in indirect contact with virus, we do standard protective measures. And also we strengthen the management of medical waste, and this is very important. And also we strengthen public education. I think how to say? I think in the period for our control of coronavirus disease, I felt that the people's scale is the most effective public education. Yeah, I feel deeply. So I think the people's, everybody of them knows how to protect themselves. Yeah. So we do a lot of things to strengthen health education for key population. Yeah, tell them how to do personnel protection, how to disseminate we disseminate information on epidemic prevention and control. Also we do a lot of things to improve public awareness of self-protection. And that TB, especially from Africa, India, and so on. This is the TB epidemic situation from 2020. Actually, I majored in TB control. So next, I will introduce something about TB control in our country and in our province. Are you interested in TB control? And this is the data of 2019. And here, just the shape is like a cord. This is China. Yeah. So you see the color, the deepest the serious situation of the TB in the country. This is the incidence rate. So you can see here is very serious. Yeah.
Okay.
And in China, the incidence rate is about 60 per 100,000 in our country. Yes, we just in this group, 60%. The 60 per not percent, 60 per 100,000 in our country. So you can see the color is not the deepest in the world because our incidence rate is not very high. But for its large population of China, we have a lot of cases. So the burden, the TB burden, the total cases number of China is very high. Next, I will introduce. So, China is one of the 30 countries with highest TB burden, and the WHO estimates there were about 0.83 million new TB cases in China in 2019. So we ranked third in the world. The first is India, and the second is Indonesia. Also, with the estimated number of MDR TB ranks second in the world. Also, the first is India, and for its large population. And this is the TB incidence rate in China from 2009 to 2019. Yeah, we can see the blue column represents the incidence rate, and this orange column represents the incidence rate of students. So we can see the incidence rate is decreasing by year. The annual decreasing rate is about 2%, just higher than that of the global average level. The annual decreasing rate of the global average level is about 1.5%. 1.5%. Yeah, and TB, the incidence of TB still ranks second in A and B infectious disease in our country. And from this slide, we can see male, female, and the whole and all the population. We can see the prevalence of TB is increasing by what? By age. Is increasing by age. Also, we can see the blue is present male, and the red present female. So we can see the prevalence of male is higher than that of female in every age group. Yeah. this slide shows that the TB prevalence in different areas. So we also can see this is urban area, this is rural area. So we can see active TB, smell positive TB, bacterial positive TB, all of them, the rural prevalence is higher than that of urban. Yeah. Rural is higher. And this slide shows that the different areas, east, middle, and west. I don't know whether you know that the Eastern China is at first, I introduced that Jiangsu located along the eastern of China. So we are in this group. Yeah, and you know the west of China, Western China is poorer. It's poorer than that of middle, and the middle is poorer than that of Eastern China. So we can see the prevalence just also. So the prevalence of Eastern is higher than that of middle. The middle is higher than that of Eastern. Yeah. Oh yeah. I want to say economic situation. So the TB prevalence is linked to their economic situation. Yeah. And this slide shows the TB mortality of China, and we can see the mortality of China of TB is about 3 per 100,000, and in 2016, so from 2004 to 2016, we can see the TB mortality is decreasing, and now it is about 2 per 100,000, and the global much lower than that of the global level. The global mortality is about 17 per 100,000. So our mortality is much lower than that of the average level of global. Next, I will introduce TB burden in our province, in Jiangsu province. Jiangsu province has 5% of TB burden in China. 5%. There were about 25,000 new TB patients. This system is internet-based national TB management information system. All the TB patients and all the suspect, all of them, the information of them will input into this system for management, for us to manage them better. Yeah. So every TB patient and every TB suspect we can find in this system. Also, we do some highlighting work on some new challenge, such as to explore the cooperation mechanism between the TB designated hospital, CDC, and the community health center. Just now I mentioned that TB designated hospital, they are in charge of diagnosis and the treatment. Yeah. CDC, they are in charge of the management of TB control of the whole area. And the community health center, they are in charge of referring the suspect and do DOT work. Yeah. So we need to explore the cooperation mechanism between these three hospitals, CDC, and community health center. And also we do some pilots of TB control among floating population, just migrants, floating population, MPR, and TB HIV co-infection patients. Next, I will introduce the technical strategy of TB HIV control. I think perhaps a lot of you are interested in TB and HIV co-infection because some of the country, in some of the countries, the HIV is higher epidemic situation. Yeah. So I will introduce the situation in our country. Yeah, so in our country, we established the cooperating mechanism between TB and the AIDS sectors. Yeah, and we implementing HIV test among TB patients. In HIV higher epidemic area, all the TB patients need to be tested HIV, and in HIV and in middle and lower HIV epidemic area, the patients with high risk behavior of HIV will be tested HIV, and be tested. Will be implemented HIV test. Yeah, and also with the blind TB screening for HIV and AIDS cases. Yeah. For all the HIV and AIDS cases with the blind TB screening, yeah. You know the HIV and AIDS cases is a high risk population for TB, yeah. And also we provide free treatment for TB HIV co-infection, free treatment. And okay. Next, I will introduce the policy and the strategy in TB control in our province. In our province, Jiangsu government established the coordinate committee of prevention and control important disease, including TB and AIDS. TB control project was set down by Jiangsu province government every 5 years. The network of TB control was founded in province, city, county, township, and village level. Yeah. We also do a lot of things to enhance human resource development. First, we increase the number of technical staff at all levels. We strengthen training at all levels with emphasis on doctors in urban district and rural townships. And this is the TB control project of Jiangsu provincial government. We have this project every 5 years. And from this picture, we can see the financial input is increasing by the year. And the blue represents the national level, and the red represents the provincial input. And this represents the city financial input, and the green represents the county financial input. So the financial input is increasing by year. In our province, we also do high quantity dose. What's the meaning of high quantity dose? First, we provide free testing and free treatment for all the TB patients in our province. Besides microscopy. In our province, we also provide molecular detection for all the TB patients. And also X-ray, chest X-ray examination is free. And in our province, we not only provide the first-line anti-TB drugs, we also provide second-line anti-TB drugs. You know, the second-line TB drugs is very, very expensive. Yeah. But the MDR TB, they need them. Before, a lot of MDR TB, they refused to be treated because of the higher fee of treatment. But now in our province, we provide free second-line anti-TB drug for them. Also, we provide in our province, we provide financial reward to village doctor for case reporting and case management. Yeah. We also provide travel and nutrition allowance for migrants TB patients. Yeah. Of course, the residents patients, of course, they will get the allowance. So in our province, every TB patients, they will get travel and nutrition allowance. Also, we intensify health promotion. We strengthen collaboration in hospitals, CDC, and community. Yes, I just mentioned it exactly before. Also, we enhance the laboratory network. The laboratory network of TB was all founded in province, city, and county level. And in our province TB laboratory, we can do almost all the examination, such as sputum smear, culture, TB strain identification, drug susceptibility test, and hand and gene expert and so on. We can do almost all the examination for TB in our province TB laboratory. And for the prefecture TB laboratory, they can do sputum, smell, culture, strain identification, DST, and hand gene expert, and gene chip, and so on. For all the county TB laboratory, they can do TB, sputum, smell, and TB culture. Also, all of them has their molecular machine to do, such as expert lab. So in our province, just in the county level, they can test the rifampin resistance TB patients. So they can do this examination, and then they can find the RR patients, rifampin resistance TB patients, and then transfer them to the city level TB hospital. Because only the city level TB hospital, they can treat the RR patients and MDR patients. And this is our laboratory, province laboratory. This is our laboratory. This is some machine instrument in our laboratory. And this is a picture of one of our city laboratory, Nanjing. Have you ever been to Nanjing?
Yes.
Yeah.
No.
So this is just now I mentioned, this is the reporting system. And by this system, we can individualize the data of cases. We can do fast case searching and also do timely assessment for program. Just now I mentioned several times for FDR-TB. So you know FDR-TB, yeah. So I will introduce the DOTS Plus strategy for FDR-TB in our province. Yeah, we implement the DOTS Plus strategy for diagnosis and treatment of FDR-TB in the whole province. So only in our province, all the FDR-TB can get free test and free treatment. Yeah, only in our province. Yeah, in our whole country. Yeah. So all suspected MDR-TB were tested by TB culture, TB DST, and hence gene expert in all the countries. Yeah, all of them are free, and all MDR-TB patients were treated by MDR-TB hospital. Yeah. And all MDR-TB patients were included medical insurance, and about 30 to 90% of medical fee could be applied for reimbursement. Yeah. And this is some picture of Zhenjiang TB designated hospital. Have you ever been to Zhenjiang? Yeah, so you have been to many places. Zhenjiang and Nanjing, yeah. And this is the FDR-TB clinic, and this is field room, and this is work. Yeah, it's Zhenjiang. I know some of you do some research work in Zhenjiang, this hospital. So why you went to Zhenjiang? Just for travel? Just for travel. Okay. So next I will introduce the TB control achievement in China. We can see we do great contribution for global TB control. We achieved the TB control targets in 2005. We promoting that the Western Pacific region was the only area which had achieved the global control targets. And we can see our country is one of the 25 countries that met both targets by 2005. And we also can compare the TB prevalence between 2010 and 2000. Or we can see the prevalence of active TB and the sputum smell positive TB and culture positive TB. The prevalence is decreased a lot, and the annual decline rate is about for active TB is about 0.2, and for positive, the annual decline is about 9% and 6%. So China has dramatically reduced the TB burden in past years. And still, I want to introduce the progress in TB control in our province. So this is we can see from this slide. This slide shows the increasing prevalence rate of TB in our province. Yeah. The blue line represents the active TB. The red line represents the spill smell positive TB. Also, we can see from this picture, the active tuberculosis registration has been declined steadily since 2005, and the registered TB fell below 30,000 in 2016. And this slide shows the blue represent the incidence rate for the whole population, and the orange represents the incidence rate for the students. we can see for the past years, from 2008 to last year, we can see the incidence rate is decreasing. Yeah. Also, I want to introduce the TB control project of China and Gates, Bill Gates. Do you know this project? Yeah. And the China and the Gates Foundation. Why I want to introduce this project? I think this project have helped us a lot. Even the project is ended, but a lot of good experience are still used in our TB control work. So this project is to strengthen the diagnosis and the treatment of tuberculosis, and to strengthen China's national tuberculosis program by the use of new technology. Even though the project is ended, but the new technology is used in our province, or even in the county level. So, three new one stressing. What's the three new? First, the new TB diagnosis technology, such as LED, hand, lamp, gene expert, gene chip. Yeah. And the second new is the new TB patient management technology. We use the mobile phone and all the electronic kits to manage the TB patients. Have you ever been seeing these electronic kits? I met some students from Africa, and she is very interested in this kit. What's this electronic case? And we put the drug into the case, and every day in the fixed time, the kids will bling. And when the patients hear, then they open the case and take the drug. And the workers, the TB workers, because the TB workers can get the information, can get the information of the behavior of opening the case. So every day, they can the TB staff, they can monitor whether the patients have taken the drug. So that the electronic case is very interesting and useful. And the third new is the new TB financing mode. The funds of medical insurance, government funds, and what's the strengthen? Just strengthen TB prevention and control service system. What's the service system? As just I mentioned, the TB designated hospital, the CTC, the community, the basic community health center. Yeah, this is the service, the TB prevention and control service system. And also, even though we do a lot of work on TB control, we still have a lot of key challenges ahead, such as MDR-TB, such as TB-HIV, and such as TB in migrants, such as inadequate human resource, such as high TB infection in general population. Yeah, do you know the rate of TB infection rate in our country, in China? Do you know? Yeah, about 20% about 20% of the population is infection person. So the high TB infection in general population. Next step, we want to improve quality of DOT and DOS plus implementation. Also, we need to integrate issues like TB control among migrants, MDR-TB and TB-HIV. And also, we will provide free diagnosis and treatment for all TB patients using the Stop TB strategy. So that's all. That's all for